Our hypothesis was that a single dose of subcutaneous injection of low-dose Ethica, which is 0.1 mg per kg, should be able to produce adequate analgesia within the multimodal analgesic regimen for postoperative period.
Welcome to The Last Word, the official ACLAS podcast dedicated to connecting and informing the laboratory animal science community. Each episode takes a closer look at recent articles published in our journals, JAAALS and LAS Pro, and features interviews with professionals advancing the field. I'm Jennifer Smith, your host. As a laboratory animal veterinarian and the Director of Education and Scientific Affairs at ACLAS, I look forward to sharing these conversations with you. Let's discover something new together. In this episode, I'm joined by two exceptional individuals and new friends. We are going to be speaking with Dr. Kasra Pouriani and Dr. Niora Fabian. And I'll give you just a quick introduction of these two folks, and they're going to tell us a little more about themselves too. But let's start with Dr. Pouriani. He is currently a lab animal resident in the Division of Comparative Medicine at MIT, and I'm told for only a week or so. And I'm sure Dr. Pouriani will tell us more about that. He also holds a PhD from the University of Tehran. And then we also have with us Dr. Niora Fabian, who is a research and clinical veterinarian in the Division of Comparative Medicine at MIT. And she received her DVM and MS from the University of Florida College of Veterinary Medicine. She also completed her lab animal training program at MIT and is ACLAM boarded. All right. I am so excited to talk to you guys today about your paper and also just to kind of find out more about you. So if you would please tell our audience just a little bit about yourselves, how you got into lab animal, what your plans are next.
Sounds great. Hi, everybody. My name is Niora Fabian. I'm currently a research and clinical veterinarian at MIT. I have a dual position at the Division of Comparative Medicine as well as in the Department of Mechanical Engineering, but this work is essentially with the Division of Comparative Medicine. I'm from Boston originally, and I've enjoyed doing research since I was a biology major undergraduate student at Boston University. I did a master's program in veterinary medical sciences at the University of Florida, where I focused on infectious diseases and alligators. So that was really fun. And then I stayed at the University of Florida for vet school. After that, I did an avian and exotic internship and focused on avian and exotic medicine back in Boston. And throughout all those experiences, I really loved doing research. I found a variety of research projects, and I really missed doing research and really wanted to continue doing that as part of my career. So I pursued a lab animal residency, and I knew that that was going to allow me to also kind of work with a lot of diverse species. So that was really how I kind of got involved in lab animal medicine. So I did that at MIT at the Division of Comparative Medicine. I love that. I finished that in 2021, and then I stayed on as a staff veterinarian. And when I was a resident, I did a lot of research projects. I really took full advantage of that. We ended up doing several studies in Marmosets. I was lucky to get a GLASS grant and an ACLAM Foundation grant, and that was generously supporting some pharmacokinetic profile studies where I looked at both immediate release buprenorphine as well as extended release buprenorphine. And I did basically pharmacokinetic studies. And so we were able to publish those over the course of a couple of years. And I wanted to fully dive into as much as possible, like the efficacy component. So those studies were great because we were able to kind of establish the PK aspect and the safety, but really these were in healthy animals that weren't undergoing any surgeries or experiencing any pain or anything like that. And there's always that question about, well, what about the pharmacodynamics or the efficacy component? And so in order to kind of like expand on that work and for our data to be more meaningful for clinicians or veterinary technicians working with marmosets at MIT or other institutions in research, especially evaluating animals cage side post-operatively, I wanted to develop this study where we would help standardize or refine how we evaluate animals after they undergo a surgery and have analgesics on board. So that was basically kind of my background and how I got interested in this project.
Oh, that is fantastic. I'm so glad you shared all of that because, like I said, our listeners, they really like to know who decided to do this study and why and those types of things. And I just find it so interesting to hear how people come into lab animal. We all get here by different paths, and I think it's
Yeah.
really a fun part of the podcast. All
Yeah.
right. So, Kasra, your turn.
Hi, my name is Kasra Pouriani, and I was born and raised in Iran. And I did finish my vet school in northwestern part of Iran. It was a 6 years program straight after high school. And during my vet school, I was really got into science and specifically physiology and neuroscience. So right after the vet school, I was able to get the grant and I started a PhD program in University of Tehran in physiology in the veterinary school. And the main focus was neuroscience. And we were studying the basically neuroaminergic systems in the brain and how their interactions is finally increasing or decreasing appetite. So my first basic encounters with the lab animal medicine was during my PhD. So one of my animal group in the study got sick and I was working with bird neuroscience. So at that point, so I realized how valuable is my veterinary background and research. And that stayed with me. And after finishing my PhD, so I moved to the US because my school was non-AVMA accredited. I knew if I want to practice veterinary science and veterinary medicine, I need the license. So I did the ECFEG for foreign graduate veterinarian. And it took me a couple years to get the US license. And after that, I was working in emergencies, urgent care, and GP clinics in San Francisco and seeing dogs and cats specifically. Although being on the clinic was so satisfying for me, but I wanted to also still have science and research throughout my life. So for that reason, I looked back and I went through the match process and I got matched with MIT. And I arrived at MIT, and at the first day I met Niora, and we were talking a lot about like neuroscience, pain, and all of that. And I noticed that she did a lot of PK study, and we had a conversation about, okay, so what about the efficacy of this PK study? So have we done any study related to that? And then we had a lot of good, productive conversation about that. And that's how the study started to form. So we were thinking about the efficacy study. Right now we have a PK and how can we test the efficacy? MIT has a very broad and specific and highly complicated transgenic program for marmoset. And the ultimate goal is to find a cure and treatment for neurodegenerative disease. So for that reason, the transgenic requires ovocyte collections, which from now on we call that OPU for female, and also for male, the vasectomy procedure is required for the whole bigger picture. And these two procedures are very standardized in our transgenic core, although there are several other surgeries are happening under the IACUC approved protocols. But we decided after pros and cons of our choices to go with ovocyte collection, OPU, and vasectomy, and trying the efficacy of this established PK study that they are staying above the therapeutic range to see in the real life when the animals are going to a real surgery, are they going to be producing adequate analgesia in the multimodal regimen or not? And that's how everything started.
Oh, my goodness. I love it. I love hearing all of that, how you started and how you came to this. And I especially love that. I think we found our soundbite for this episode in you saying that being a veterinarian, having that background was so helpful for your research. And I just love that because I think all of us lab animal vets, we feel like that's why we're here. I love it. And just to hear everything that you guys are doing and then we're able to accomplish. So the paper we're talking about was recently accepted in JAAALS. It's titled Comparison of Different Formulations of Extended Release Buprenorphine in Perioperative Pain Management in Common Marmosets. And of all the species, genus and species names that I had to memorize for boards, I think the common marmoset is my favorite. I always thought Maybe I should name a kid no, look, I can't even say it. Calatrix Jackus.
Yeah.
I just think it's such a cool name.
It is a cool name. Yeah.
It's a very cool name. All right. Wow. Thank you again for just a great intro there and kind of why you took this project on. It makes sense. And I also, thanks for shouting out Niora the GLASS grant, because last year we were very proud of that program, and I'm excited that we don't always get the GLASS awardees are not always ones that are on the podcast all the time. So it's so nice when someone is, we can talk about that. So thank you for...
Yes, we're so grateful for that support.
I appreciate that very much. All right. So tell us a little more about the team. It takes a team. So tell us who did what, and we'll kind of get into this paper.
Sure. Yeah. So as we kind of talked about a little bit earlier, I kind of came up with the idea just because in the conversations of the pharmacokinetic data, there's always a question when we had discussions or research seminar, like, what about the efficacy? And so I kind of really wanted to follow up on that. So I kind of came up with a general design. We have other veterinarians, of course, at DCM. And so I wanted to work with one of our Marmoset veterinarians. So Martina Jackson, she and I went over suitability of animals and like which types of procedures would be best to do some kind of efficacy study. And then so we also kind of just like went over like individuals, like who is actually a good candidate for surgery and so forth. And so between her and me, we selected animals, and of course with the lab that we worked with for their transgenic program. I also blinded Kasra, who was our single observer for the study, who did all of the readings and the recordings for all the study animals. I made sure that he was blinded to all the treatment groups so that we could have a non-biased design. And then we also worked with Rochelle, who's our behaviorist. She helped go over the Marmoset pain scale that we developed, so that there was nothing validated for Marmosets. And so we kind of had to start from scratch and then think about like, well, what categories of things are we caring about and observing? And so we kind of wanted to make sure we had a scaling system that was practical and realistic and so forth. So between her, Kasra, and Martina, we came up with a good composite measure pain scale for this species. And then we have some ACLAM boarded veterinarian colleagues at the Broad Institute, Nathan Chan and Tyler Karen. They work with marmosets there and have a lot of expertise and work with the same group as far as this transgenic program. And so we were able to expand our cohort of animals by working with them, which was wonderful. And they're super collaborative. So that was basically our team.
That's great. Thank you again. And we always love to hear who did what and who worked on the paper as colleagues. And it's especially, it sounds like a really great collaboration. I love that. All right. So in the introduction, you've got some really good information, especially just kind of calling out that, hey, there's not a lot of literature on pain assessment modalities for marmosets, as well as just in general what analgesics obtund pain in this species. So I'd love to just hear a little bit more about the introduction.
Yeah, so as we alluded to that earlier, Niora had done a lot of pharmacokinetic studies, and in her paper, she discovered that the therapeutic doses for Ethica 0.15 mg per kg and Ethica 0.1 mg per kg and Bup lab, which was formerly known as Bup-SR 0.15, they're all staying about the therapeutic range, so for 72 hours post-operatively. So, I mean, post-administratively, at that point, there was, on the pharmacokinetic study, there was no surgery. It was just on the healthy animal. So this above the therapeutic level was extrapolated from the human. So, and obviously, animals are not talking to us, and we have to know what we're doing for them is really adequate and controlling their pain. And that's why we are going after some other indirect measures, like looking at their behaviors, their postures, their eating, and a whole other host of behaviors and subtle differences in their daily routines that you can discover whether they do have enough adequate pain control or not. So because these 3 doses of these 2 formulations were staying above the therapeutic range, so our hypothesis was that a single dose of subcutaneous injection of low dose Ethica, which is 0.1 mg per kg, should be able to produce adequate analgesia within the multimodal analgesic regimen for postoperative period.
Oh, that's great. It's such a good hypothesis. And I can't wait to walk through the paper with you and find out if we could confirm that or not. But we'll wait as a teaser. All right. Well, thank you for that. All right. Let's just jump into this study design. Anything we should know about? I always kind of ask that question open-ended because lots of times there's little idiosyncrasies of each study that are really important to call out. So feel free, tell us about your study design and anything you feel like our listeners would really need to know if they were going to try to replicate this in their own shop.
Definitely. So basically, I'll walk through the components of the composite measure pain scale for common Marmosets that we developed. So this is based on multiple categories, and this is something designed with basically keeping in mind that this is a cage-side evaluation because realistically, most of the time as clinicians and other medical professionals, we're doing things like in person and we're not like recording a patient and just watching back on that recording, even though that can provide a lot of other insights for sure. But just to make it in a very practical sense, we wanted to really focus on things that we're already looking for cage side. So we looked at activity, appearance. So, is the animal bright, alert, responsive, quiet, or depressed, or recumbent? Is the animal moving around normally in its enclosure, or is there actually decreased activity or lack of interest or immobile? And then as well, we wanted to look at body posture and things like, are they piloerected or just generally like looking uncomfortable? Hunched is a big thing that we look for. So we kind of had a grading system for that. And then also abnormal or normal respiration. These animals are undergoing surgery also. So we evaluate the surgical site and see if they are bothering at it, are they scratching at it or guarding or anything like that. So if they're not paying attention to it and are kind of going about normally, then we basically call that normal. And then we also looked at social interaction. So are they also interacting with the human observer? So often we'll kind of check on them and offer a treat and see if they take that. So we kind of took all of those things, like the kind of normal things that we normally would evaluate an animal and try to put that all into like a very organized system. So basically there's a scoring from 0, then 1, 2 to 3, with 3 being the most extreme, like in a painful manner. So 0 to 1 is, if anything is noted that corresponds with that number, it's basically added up. And then so 0 to 1 is no pain or no to minimal pain. Anything above a 1 is painful and would require rescue analgesia. So that was the pain scale. And then we also basically looked at hyperactivity. And so that was an interesting aspect of this project because we wanted to look at animal activity. We know that opioids can cause hyperactivity, and that's actually been demonstrated and published on multiple species, buprenorphine as well as other opioids. So we wanted to kind of evaluate that as a side effect of the drug and not necessarily really as a measure of pain, but we really wanted to take note if animals were hyperactive after getting a dose of the medication. So we kind of evaluated that separately, and that again, which was cage side, and we excluded that mainly because of the dose-dependent opioid effect that I just mentioned. So we also looked at the injection site reaction. There's a risk of injection site reaction with really any drug. We've noticed that either with the compounded and sometimes the pharmaceutical grade drug, we compared both in this study. We wanted to make sure there was no erythema or swelling or any other abnormality. So we kind of just did a yes or no, is there a reaction? So the design of the study was that basically we evaluated animals on 2 baseline days. We wanted to make sure we understood the normal behaviors and the normal scoring of the animal before they underwent any surgery or received any medication. So we took those scores before, and then they also were evaluated 4 to 6 hours post-operatively, as well as 24 hours, 48 hours, and 72 hours. And so for each dose and formulation, we had males and females, and we wanted to make sure we were inclusive for that. And so, as Kasra mentioned earlier, the males underwent a vasectomy, the females underwent an oocyte pickup or harvest or OPU. And so for each treatment group, we had 3 males and 4 females. The treatment groups were Ethica at 0.1 mg per kg, Ethica at 0.15 mg per kg, and buprenorphine ER, the extended release at 0.15 mg per kg, because that is the dose that we had historically been using at MIT. So we wanted to just kind of use that as like kind of our comparator. We didn't want to have any group that did not receive analgesics, of course. So that's just, although that would be perhaps in some situations the best control you could have, we absolutely were not set up for excluding analgesia from these animals. So basically, we weren't quantifying things, and I can even talk a little bit more about that because I actually did use a different system to quantify activity in another study, but because we were doing kind of cage side assessments, we wanted it to be a little bit simpler. So we had to kind of be a little bit strict with our definition. So visually, we were observing increased locomotor activity, and that was characterized by seemingly purposeless circling movements or back and forth jumps between two surfaces. For example, they have like a hammock and like a nest box and like a perch and that sort of thing. So if it just seemed like it was really without any kind of purpose and there was an increase in that when we were observing them in that period, that was how we define that. And it had to happen at least twice during that observation period without a clear goal, meaning like they weren't interacting with an enrichment item or eating or engaging with a cage mate and that sort of thing. That was basically the design of the evaluation and the schedule. And yeah, in total, there are 21 animals that we evaluated.
Thank you for that. And just for being so complete with that, I really appreciate it. I mean, it really, especially if somebody's not sitting right in front of the paper, it really helps. And I know we're going to talk a lot more about the pain scale and just kind of more of its utility, but I really appreciate you laying that all out as well as the doses because it's always something.
Yeah, and I can also just mention that, all animals got a preoperative local analgesic, like a local block, and then immediately post-op, they received meloxicam as well as the post-op buprenorphine, and then all animals also received 3 days of oral meloxicam. So that was kind of like the multimodal standardized analgesic plan that these animals had in place for their IACUC-approved protocol. And so we kind of use that scaffold system to evaluate the different formulations and doses of the buprenorphine.
Got it. And I really do appreciate, too, that you really were flexible in morphing your study around what is practical and applicable at your institution. And, I think that's really important, too, right? I mean, not everything is in a perfect, pristine world. And so I love that you were able to, pick the doses that are approved for your shop. That's what you're using and put them into practice in this paper. And we're able to evaluate those against your pain score or pain scale, I should say. So I appreciate that. It's time for a quick break to hear about the ACLAM Learning Library. Hey, are you ready to elevate your team's knowledge and skills in laboratory animal science? Well, the ACLAM Learning Library is your one-stop solution for comprehensive training. With courses designed for everyone, you can train your entire team in one place, earn valuable ACLAM CEUs and RACE CE credits, and take advantage of group discounts to maximize that investment. Getting started is easy too. Sign up for free to access select courses instantly to explore a vast library of resources. Empower your team, stay ahead of the field, and grow with the ACLAM Learning Library, your trusted resource for laboratory animal science professionals. All right, so results. What did you find?
Well, we found a lot of interesting results. I'm going to start with the first result, that was the pain. So basically, our composite pain measure scale design showed that no animal was painful and no animal needed to have any rescue analgesia. Basically, either everybody were 0 or 1 in this study for all tested drugs and formulations that we use. And I do want to emphasize that our anesthetic and analgesic regimen was multimodal. And as Niora mentioned, we had local block, we had meloxicam, NSAID, which is an NSAID medication, and buprenorphine. So the other interesting finding in this study was the increased activity or hyperactivity. So we did see a very interesting trend in our study. We did see that the majority of the male population in this study had more activity when you're comparing them to the total number of female in this study. So basically, 55% of the male in this study had more activity, increased activity compared to female, and the female percentage was 25%. And then we needed to have a little bit more information about these differences of hyperactivity for male and female, and also to look into that. And for each drug, was it any association between each drugs in this study and hyperactivity? We also found that Ethica, the low dose, has the least hyperactivity, and Bupe lab has the most increased activity in the tested doses. And then we also wanted to know in each group and for each single drugs at each tested dose, is there any differences between male versus female? And we also saw the same pattern. We saw that for Ethica 0.1 mg per kg. So there was no hyperactive female, but there was 33% hyperactive male. And when we compare that to Bupasar or the Bupe lab, so 67% of the male were hyperactive and 50% of the females were hyperactive. So we still see that, the males are still overall more hyperactive than female. And I want to say this hyperactivity is a trend in our study, and this is not statistically significant because we had a limited number of animals enrolled in our study. But it was still a cool trend that we wanted to bring it to our study. And for the injection site reaction, as Niora talked about that in the study design part, so we were looking at the incidence of the injection site reactions for any of these tested drugs. So basically, do they have any injection site reaction? Yes and no. So we also found that information that Ethica at the low dose had the least injection site reaction compared to lab. And this is an interesting finding, although I should say that no animal in this study needed to be treated for the injection site reaction.
Okay, I appreciate that.
Yeah, and that was all of our results for this study.
Well, that's a lot there. It's a lot to unpack as well. And I just really appreciate you guys spending the time here and being so thorough. It's very helpful. All right. So anything really surprise you on those results?
I would say seeing the trend of the male are more hyperactive than female was quite surprising for me. And I was not thinking about whether, there will be, because injection site reaction, we really did not find any differences between male versus female, that any trend like that. But we did find that for the hyperactivity. So, and that reminds me that how thorough and specific you should be while you are doing observation and study designs to make sure that you are catching any subtle details in this study.
Yeah, good point. A very good point there. I just loved hearing that, and I do appreciate your summary of that. All right, so let's talk about your discussion. You've got all this data. What did you think of it? And as well as we always ask people to kind of talk about or comment on if there were any limitations to the study or anything that you feel like you would want to do next time.
Definitely. So basically, we knew that we had some limitations because there was no standard or validated way to evaluate for pain in common marmosets, although we know that there have been some more recent publications in non-human primates, which is great. There are some facial grimace scales that have been validated for several species of macaques, but, of course, they're very, very different from marmosets, and so there is really no way for us to kind of use that for this. One thing we really tried to explore was using a camera setup to record. And we found that, at least for this project and in the time course that we really wanted to accomplish this, we didn't have a practical system for that to really see everything that we needed and having the perfect angle to capture, really everything that we had on our scale. We just weren't really quite set up for that. Although we know that we can find a lot of nuanced data if there's not a a direct observer. So I think that was something we really had to reconcile with. So we basically, in the future, we would certainly want to explore that to add as a refinement. And because we only had one observer, I think to make it more practical in the future, we would certainly want to validate it and have the ability for multiple observers. So we're actually planning on doing a study this summer to develop to do an inter-observer validity assay so that it can be used more widespread. So that is something that's really exciting that we're planning on doing in the next few months this year. And so, stay tuned.
Yeah, I cannot wait.
Yeah, but I think the way that we could really reconcile that was we had, a single dedicated veterinarian who's well trained working with these animals, who was blinded to all the treatments. So I think that was, really the best way we could go about this. And at the same time, a lot of the clinical observations of primates are cage side and not necessarily through a recording. So I think we're kind of still capturing what is fairly relevant, although I'm excited to know about or think about future ways that we can refine the way we observe animals and make sure that they're doing well after any procedure, and not just surgery. Even there could be all sorts of procedures that they need extra observations without necessarily perturbing them. So just keeping that in mind, I think that's an exciting next step. Those are the biggest things. But yeah, Kasra, do you have any things you want to add about that?
So I think the other would say maybe obstacle or limitation of this study, maybe not really limitation, but kind of challenging to do. So it was challenging to coordinate between two institutions overall. And I say thank you to Niora and everybody else in this study that helped out with coordinating to let everything goes and run as smooth as possible. I would say we have a very well-trained technicians and personnel and the veterinary team that helped us to run this study smoothly. And I would say that, again, no animal needed rescue analgesia in this study. And everybody was all the males got the 0 on the pain scale, but a very few females got the score 1. So, but score 1 and 0, we defined at either no pain or very minimal pain. So we were thinking about what could be a possible reason for just a few females in our study, they got scored 1. So one thing could be just going back to the difference between male and female physiology for pain. So there are literature in human medicine that it says that generally female are a little bit more sensitive to pain compared to a male. So that could be just going back to an inherent physiological difference like hormonal and neuroperceptions of the pain between male versus female. The other possibility here is a very few marmoset in our study, a female marmoset, they had the previous OPU procedures, and that can end up to have some fibrosis and adhesion at the site. And that could be just enough restriction in the tissue. And after the surgery, that could be a potential cause for some females that they were score 1. So we went back into marmoset literature to see if there is any specific difference between male and female for pain. We found a study that they were looking at the plasma concentration of the buprenorphine, male versus female, although that study had a limited power, but they were saying that the male marmoset has the higher plasma concentration of buprenorphine compared to female. And then in our study, we did not draw the blood after the surgery because, as I said, no animal was painful, and we did not want to disturb the animal after the surgery, taking a risk, because if you pull the animal from the cage, you are always running the risk of a dehiscence after the surgery. So we did not do the blood and to look at the plasma concentration level. But for future study, we may consider to compare the plasma concentration of the drug between male versus female to see if there is any difference there. The other interesting finding that we already talked about that was the hyperactivity. So I went back to a literature with Niora and just say, what could be a potential mechanism of actions for this hyperactivity? And, because of my background in neuroscience and my PhD, I explored about that potential possibility, although there is no paper and literature about specific marmoset, but in the other species, there are some literature about the dose-dependent hyperactivity could be related to activation of the mu opioid receptors, followed by triggering the dopamine release and potentially suppressing the GABAergic transmission in the brain. And that's a potential proposed mechanism of hyperactivity induced by buprenorphine in other species. And this could be the same for marmoset, although this needs a further investigation for future studies.
Oh, that is so interesting. And that last part is also interesting because then you layer on that sex predilection for the hyperactivity. It certainly adds another layer there, right? But interesting. I think we just designed your next study. So that sounds good. Yeah. All right. Well, you guys, thank you so much for being here. Now, we always ask one final question of everyone, and they're always kind of the same. So it's not a big shocker, but your question is, what advice would you give somebody wanting to set up or establish an effective analgesia program for marmosets? Maybe they're new to working with marmosets, or maybe they're, moving from, more observational to doing more surgical modeling, and they really want to have that confident analgesia. What advice from everything you've learned here would you give somebody?
That's a great question. So working with common marmosets, I don't think you can say that there's like a one-size-fits-all type of protocol, but I will say that it's important to emphasize multimodal analgesics whenever it's possible, meaning, depending on the procedure and depending on the IACUC protocol, say in a research setting, and the specific animal's health and so forth. So I think all of that really is context dependent. And so, each specific animal needs to be assessed before, deciding if the animal is a suitable candidate for a certain procedure, as well as the analgesic regimen. And then, of course, based on any outcomes or even expected or unexpected sequela, I think that's really going to be important to keep a very close eye on all of that in order to make appropriate adjustments and to, refine the regimen as needed. So I think one really unique thing about common marmosets and also other New World monkeys, of course, is that they have a very sensitive response to opioids, specifically with their respiratory system. So they can have profound respiratory depression at doses of buprenorphine and other opioids that are considered kind of like the more typical dose for other species. And so, it's really important to double check the dosing that's being used. If you're not using, an extended release buprenorphine and you have to just use a short acting immediate release version, some places, and we recommend diluting that drug to ensure that it's very precisely, accurately dosed to, again, avoid any potential overdosing. So those are just, some really important things to keep in mind when working with opioids with this species. But again, I think it's really managing them based on the context and whenever possible, using a multimodal approach. So yeah, that's how I would advise somebody.
Yeah, that is great advice. Kasra, anything from you?
Yes, I would say that you can use either of these doses of drugs in our study, although I think the low dose 0.1 mg per kg will cause the least increased activity and least injection site reaction occurrence compared to other tested drugs. So that's what I would say. And again, I would reemphasize on the multimodal analgesia regimen. It is really important to consider that for your surgery. And the final thing that I would say that the successful outcome needs teamwork. And we are very blessed to have a very well-trained team, both at MIT and Broad Institute, that we were able to carry out this study.
That is fantastic. I loved everything about talking with you guys today. You really do research well. And I think for anyone listening, this is how you do it, you guys. So if you're trying to set a study up and you're just kind of wondering in the real world, how do you do it? These are two people I would reach out to. Their information is in the show notes. And if you really want to do it well, reach out to these guys. I love talking to you. I loved talking about the marmosets because most people, I talk to that work with marmosets say the word marmoset, and then there's kind of a sigh. It's just like
they're delicate and unique and wonderful.
Yes, fiddly little beautiful creatures. And so I just love all of your concern for their welfare and just for getting research right and for doing research that works in your institution. I just can't say enough about that. So thank you again for being here, you guys.
Absolutely.
Yeah, keep up the great work.
Thank you so much.
Thank you.
Thanks for joining us on this episode of The Last Word. We'd love to hear your thoughts, so be sure to leave your feedback in the comments. And don't forget to subscribe for more great content. We encourage you to submit your research manuscripts to our journals, JAAALS and LAS Pro. We're always looking to feature impactful studies. You can also connect with us on our social media channels or email us directly at info@alas.org. We appreciate your listening today, and we'll see you next time on The Last Word, an ALAS podcast. Until then, stay curious and stay connected.